name is U.T. Moore. Talk a little bit about my history. I had a very active life. I was in a management role with a company and worked at several sites in plant environments, so therefore I was on cement, walking, doing a lot of those kind of things. Also, in a lot of years, I was traveling on airplanes and cars. Loved lawn work, so I did my own lawn work and actually played golf 2 or 3 times a week for 20 plus years. So I've actually been pretty hard on my body over my lifetime. The reason I'm actually here for the last 6 years, I've had a problem with my left knee. I've had gel shots, a series of 3 several times over the 6 years, and it normally would last about 1.5 years, and then my pain would come back. And my last 6 months, which was last year, my doctor said you're bone on bone. That particular gel shot only lasted 6 months, so he said I could have an operation anytime he would like. So I set the operation up after Christmas on January 2nd. Also, during that same period of time, I've had a problem with my right knee with a couple of shots in it. I had it 3 years ago. I had a rotator cuff surgery on my left arm, which was an awful operation. I thought it was major because it took me 7 weeks to get out of a chair to sleep on the bed. So still have a little bit of pain, which the doctor said was expected. And on my right shoulder, I started having pain a couple of years ago, and I've had 2 shots in that shoulder. And prior to scheduling my operation on my knee, I could actually reach over to my nightstand to turn the TV off at night in the bed, and my arm would just kill me. So I had a problem with my right arm also. But coming up to my surgery on January the 2nd, I was getting prepped. My wife and daughter, who was a nurse, was there. They hooked me up to a monitor, and my daughter says, your heart is on AFib. My heartbeat was over 200 a minute, and I didn't feel that good. And when I went back and thought about it, I had that feeling about 2 days prior to that. So they immediately took me to ER, stayed there 4 days. Doctor says you can't have this operation for a period of time until your heart is settled out, which they did get everything fine. But in the meantime, I looked for solutions for my knee. Did a lot of reading about stem cells, talked to a medical facility in Charlotte that does stem cells, was not happy with what I saw because I had to spend a couple of days there, and they used my own stem cells versus new stem cells, and they did not have a plan where they used platelets like we do here or therapy. I did visit another facility in Myrtle Beach for stem cells, was not happy with what I saw there also. So I then set up an appointment with Advanced Medical Solutions. And basically when I came in the door, talked to the receptionist, toured the facility, talked to the people that would be doing the stem cells, everything just clicked. It told me that this was a place I ought to be. So a couple of days later, we agreed on a price, and I decided to do my left knee and my right shoulder at the same time, which I did. Within probably a month, my knee pain had ceased. My right shoulder pain had got significantly better. Of course, they told me not to play golf for a couple of months to let the stem cells set up. So actually, I started playing golf the 1st of May. Been playing 2 days a week since, without pain in my left knee. My shoulder's significantly better. I still have a little bit of pain in my shoulder, but I'm still doing therapy and still working on that. Advanced Medical Solutions has 2 great doctors. The staff are excellent, well-trained, very personable, friendly. They care about you. They actually do temperature check on you when you come in to make sure the virus that we have is that you don't have a virus. They have done an excellent job preparing the staff and the clients during this virus period of time so that we can social distance and this type of thing. Bottom line, if you have a problem with any particular part of your body that stem cells will help, I certainly recommend that. It's a great outfit. I've had great results, and hope I don't have to use them again, but if I do, I'll certainly come back to Advanced Medical Solutions.